81. A patient with Alzheimer's disease is refusing to eat. What should the nurse do first? A. Force feed to ensure nutrition. B. Restrict fluids to stimulate appetite. C. Administer a nutritional supplement. D. Assess for causes like pain or dysphagia. Answer: D. Assess for causes like pain or dysphagia. Rationale: assessing causes like pain or dysphagia. D. Addresses refusal. Force feeding. A. Is unethical. Restricting fluids. B. Risks dehydration. Supplements. C. Require assessment. 82. A nurse is caring for a patient with Alzheimer's disease who is sundowning. What is the best intervention? A. Increase evening stimulation to tire the patient. B. Use dim lighting and a calm environment. C. Administer caffeine to reduce fatigue. D. Encourage napping throughout the day. Answer: B. Use dim lighting and a calm environment. Rationale: dim lighting and a calm environment. B. Reduce sundowning. Increase stimulation. A. Or caffeine. C. May worsen agitation. Napping. D. Disrupt sleep. 83. A patient with early Alzheimer's disease asks about reducing progression. What should the nurse suggest? A. Avoid all physical activity to reduce stress. B. Increase alcohol consumption to relax. C. Maintain a healthy diet and exercise routine. D. Limit social interactions to avoid confusion. Answer: C. Maintain a healthy diet and exercise routine. Rationale: a healthy diet and exercise. C. May slow progression. Avoiding activity. A. Or social interactions. D. May worsen health. Alcohol. B. Exacerbates decline. 84. A nurse is assessing a patient with Alzheimer's disease for infection. Which symptom is most concerning? A. Improved appetite. B. Increased social engagement. C. Fever and confusion. D. Enhanced memory recall. Answer: C. Fever and confusion. Rationale: fever and confusion. C. Indicate infection. Increased engagement. B. Improve appetite. A. Or enhance memory. D. Are not typical signs. 85. A patient with moderate Alzheimer's disease is disoriented to place. What should the nurse do? A. Avoid environmental cues to simplify care. B. Restrict the patient's access to new areas. C. Correct the patient each time they are confused. D. Provide familiar objects and clear signage. Answer: D. Provide familiar objects and clear signage. Rationale: familiar objects and signage. D. Reduce disorientation. Correcting constantly. C. May distress. Avoiding cues. A. Increases confusion. Restricting access. B. Limits engagement. 86. A caregiver asks how to manage a patient with Alzheimer's disease who is combative. What is the best response? A. Administer a sedative immediately. B. Assess for triggers like pain or fear. C. Restrain the patient to ensure safety. D. Ignore the behavior to avoid escalation. Answer: B. Assess for triggers like pain or fear. Rationale: assessing triggers like pain or fear. B. Addresses combativeness. Restraints. C. Are unsafe. Ignoring. D. Dismisses needs. Sedatives. A. Require assessment. 87. A patient with severe Alzheimer's disease is at risk for aspiration pneumonia. What is the priority? A. Encourage thin liquids to aid swallowing. B. Avoid feeding to prevent pneumonia. C. Position upright and monitor swallowing. D. Use large utensils to increase intake. Answer: C. Position upright and monitor swallowing. Rationale: upright positioning and monitoring. C. Reduce aspiration risk. Thin liquids. A. Increase risk. Avoiding feeding. B. Causes malnutrition. Large utensils. D. Do not help. 88. A nurse is teaching about cholinesterase inhibitors for Alzheimer's disease. What is their primary effect? A. Cure Alzheimer's disease. B. Temporarily improve cognitive function. C. Reverse memory loss completely. D. Prevent behavioral symptoms. Answer: B. temporarily improve cognitive function. Rationale: cholinesterase inhibitors, B, temporarily improve cognition. They do not cure Alzheimer's, A, prevent behaviors, D, or reverse memory loss, C. 89. A patient with Alzheimer's disease is hoarding objects. What should the nurse do? A, restrict access to all objects. B, provide a safe space for storing items. C, confront the patient about hoarding. D, ignore the behavior completely. Answer: B, provide a safe space for storing items. Rationale: a safe storage space, B, addresses hoarding respectfully. Confronting, C, may distress. Restricting objects, A, reduces dignity. Ignoring, D, does not address the behavior. 90. A family asks about supporting a patient with late-stage Alzheimer's disease. What is the best recommendation? A, provide comfort through touch and music. B, encourage complex tasks to stimulate cognition. C, promote independence in daily activities. D, limit sensory stimulation to reduce stress. Answer: A, provide comfort through touch and music. Rationale: touch and music. A, provide comfort in late-stage Alzheimer's. Complex tasks, B, or independence, C, are not feasible. Limiting stimulation, D, may isolate. 91. A patient with Alzheimer's disease is at risk for elopement. What is the best safety measure? A, keep all doors unlocked for access. B, restrain the patient during the day. C, limit supervision to nighttime. D, use a WanderGuard bracelet. Answer: D, use a WanderGuard bracelet. Rationale: a WanderGuard bracelet, D, prevents elopement safely. Unlocked doors, A, risk safety. Restraints, B, are unethical. Limited supervision, C, is unsafe. 92. A nurse is discussing palliative care with a family of a patient with late-stage Alzheimer's disease. What is the focus? A, comfort and quality of life. B, encouraging ambulation daily. C, aggressive treatment to prolong life. D, limiting family involvement. Answer: A, comfort and quality of life. Rationale: palliative care focuses on comfort and quality of life. A, aggressive treatment, C, may not align with goals. Ambulation, B, is not feasible. Limiting family, D, is inappropriate. 93. A patient with early Alzheimer's disease asks about cognitive exercises. What should the nurse recommend? A, focus only on physical exercise. B, avoid mental activities to reduce stress. C, engage in puzzles and reading. D, limit learning to avoid frustration. Answer: C, engage in puzzles and reading. Rationale: puzzles and reading, C, stimulate cognition. Avoiding activities, B, or limiting learning, D, may worsen decline. Physical exercise alone, A, is insufficient. 94. A nurse is caring for a patient with Alzheimer's disease who is verbally aggressive. What should the nurse do? A, argue with the patient to clarify reality. B, use a calm tone and validate emotions. C, restrain the patient to ensure safety. D, ignore the behavior completely. Answer: B, use a calm tone and validate emotions. Rationale: a calm tone and validating emotions, B, de-escalate aggression. Arguing, A, or restraining, C, may worsen behavior. Ignoring, D, dismisses needs. 95. A patient with moderate Alzheimer's disease is at risk for malnutrition. What is the best intervention? A, limit feeding to reduce choking. B, provide nutrient-dense finger foods. C, restrict fluids to stimulate appetite. D, offer large meals to increase intake. Answer: B, provide nutrient-dense finger foods. Rationale: nutrient-dense finger foods, B, encourage intake. Large meals, D, may overwhelm. Restricting fluids, C, risks dehydration. Limiting feeding, A, worsens malnutrition. 96. A nurse is teaching about Alzheimer's disease progression. Which statement is correct? A, cognitive function improves over time. B, behavioral issues resolve in late stages. C, symptoms worsen progressively. D, Memory remains stable throughout. Answer: C. Symptoms worsen progressively. Rationale: Alzheimer's symptoms worsen progressively. C. Cognitive function does not improve. A. Behaviors do not resolve. B. And memory declines. D. 97. A patient with Alzheimer's disease is hallucinating. What should the nurse do? A. Administer an antipsychotic immediately. B. Ignore the hallucinations completely. C. Acknowledge the patient's fear and redirect. D. Argue with the patient about reality. Answer: C. Acknowledge the patient's fear and redirect. Rationale: acknowledging fear and redirecting. C. Reduces distress. Arguing. D. May agitate. Antipsychotics. A. Require assessment. Ignoring. B. Dismisses the patient. 98. A caregiver asks how to prevent falls in a patient with Alzheimer's disease. What is the best suggestion? A. Keep the environment dimly lit. B. Restrict mobility to avoid falls. C. Install handrails and remove rugs. D. Encourage barefoot walking. Answer: C. Install handrails and remove rugs. Rationale: handrails and rug removal. C. Prevent falls. Dim lighting. A. Increases risk. Barefoot walking. D. May be unsafe. Restricting mobility. B. Causes deconditioning. 99. A patient with severe Alzheimer's disease is incontinent. What is the best nursing intervention? A. Use absorbent pads and a toileting schedule. B. Restrict fluids to reduce incontinence. C. Avoid hygiene to reduce agitation. D. Restrain the patient to keep dry. Answer: A. Use absorbent pads and a toileting schedule. Rationale: absorbent pads and a toileting schedule. A. Manage incontinence. Restricting fluids. B. Risks dehydration. Avoiding hygiene. C. Increases infection risk. Restraints. D. Are unsafe. 100. A nurse is discussing guardianship for a patient with Alzheimer's disease. What is the first step? A. Appoint a guardian without assessment. B. Avoid legal discussions to reduce stress. C. Evaluate the patient's decision-making capacity. D. Encourage the patient to make all decisions. Answer: C. Evaluate the patient's decision-making capacity. Rationale: evaluating decision-making capacity. C. Determines guardianship needs. Appointing without assessment. A. Is unethical. Encouraging all decisions. D. May be unsafe. Avoiding discussions. B. Neglects needs. 101. A nurse is caring for a patient with moderate Alzheimer's disease who is disoriented to time. What is the best intervention? A. Correct the patient each time they are confused. B. Restrict access to clocks to reduce anxiety. C. Provide a large clock and calendar in the room. D. Avoid using time references in conversation. Answer: C. Provide a large clock and calendar in the room. Rationale: a large clock and calendar. C. Provide orientation cues, reducing confusion. Correcting constantly. A. May cause distress. Avoiding time references. D. Does not help orientation. Restricting clocks. B. Increases disorientation. 102. A patient with severe Alzheimer's disease is at risk for malnutrition. What should the nurse do? A. Provide small, nutrient-dense meals frequently. B. Offer large meals to increase caloric intake. C. Restrict fluids to stimulate appetite. D. Limit feeding to reduce choking risk. Answer: A. Provide small, nutrient-dense meals frequently. Rationale: small, nutrient-dense meals. A. Encourage intake without overwhelming. Large meals. B. May be difficult. Restricting fluids. C. Risks dehydration. Limiting feeding. D. Worsens malnutrition. 103. A caregiver asks how to manage wandering in a patient with Alzheimer's disease. What is the best suggestion? A. Restrain the patient during the day. B. Allow unrestricted wandering to promote independence. C. Keep the patient in a darkened room. D. Use a secure lock and identification bracelet. Answer: D. Use a secure lock and identification bracelet. Rationale: secure locks and an ID bracelet. D. ensure safety. Unrestricted wandering. B, risks elopement. Restraints. A, are unethical. Darkened rooms. C, may increase confusion. 104. A patient with Alzheimer's disease is prescribed rivastigmine. What should the nurse monitor for? A, enhanced long-term memory. B, gastrointestinal side effects. C, improved physical strength. D, increased blood pressure. Answer. B, gastrointestinal side effects. Rationale. Rivastigmine commonly causes gastrointestinal side effects. B, like nausea. It does not improve strength. C, enhance long-term memory. A, or increase blood pressure. D. 105. A nurse is discussing advanced directives with a patient in early Alzheimer's disease. What is the priority? A, ensure the patient expresses their wishes. B, delay discussions to avoid stress. C, have family make decisions without input. D, avoid legal matters entirely. Answer. A, ensure the patient expresses their wishes. Rationale. Ensuring the patient expresses wishes. A, respects autonomy while capacity exists. Delaying. B, risks loss of capacity. Family decisions without input. C, are unethical. Avoiding legal matters. D, neglects planning. 106. A patient with late-stage Alzheimer's disease is bedbound. What is the priority to prevent complications? A, restrict fluids to reduce urinary output. B, reposition every 2 hours to prevent ulcers. C, limit repositioning to reduce discomfort. D, avoid skin assessments to minimize agitation. Answer. B, reposition every 2 hours to prevent ulcers. Rationale. Repositioning every 2 hours. B, prevents pressure ulcers. Limiting repositioning. C, or avoiding assessments. D, increases risk. Restricting fluids. A, causes dehydration. 107. A patient with moderate Alzheimer's disease is verbally aggressive. What should the nurse do? A, restrain the patient to ensure safety. B, ignore the behavior completely. C, argue with the patient to clarify reality. D, use a calm tone and validate feelings. Answer. D, use a calm tone and validate feelings. Rationale. A calm tone and validating feelings. D, de-escalate aggression. Arguing. C, or restraining. A, may worsen behavior. Ignoring. B, dismisses needs. 108. A caregiver asks about promoting safety for a patient with Alzheimer's disease. Which is most important? A, install grab bars in high-risk areas. B, allow access to sharp objects for independence. C, encourage unsupervised cooking. D, keep floors cluttered for familiarity. Answer. A, install grab bars in high-risk areas. Rationale. Grab bars. A, prevent falls in high-risk areas. Sharp objects. B, unsupervised cooking. C, and cluttered floors. D, increase injury risk. 109. A patient with Alzheimer's disease is refusing medications. What should the nurse do first? A, discontinue medications to avoid conflict. B, assess reasons for refusal and offer choices. C, hide medications in food without consent. D, force the patient to take medications. Answer. B, assess reasons for refusal and offer choices. Rationale. Assessing reasons and offering choices. B, respects autonomy. Hiding medications. C, is unethical. Discontinuing. A, is unsafe. Forcing. D, violates rights. 110. A nurse is caring for a patient with Alzheimer's disease who is sundowning. What is the best intervention? A, encourage napping throughout the day. B, increase evening activities to tire the patient. C, maintain a calm environment with dim lighting. D, administer caffeine to reduce fatigue. Answer. C, maintain a calm environment with dim lighting. Rationale. A calm environment with dim lighting. C, reduces sundowning. Increased activities. B, or caffeine. D, may worsen agitation. Napping. A, disrupts sleep. 111. A patient with early Alzheimer's disease asks about lifestyle changes to slow progression. What should the nurse recommend? A, Increase alcohol consumption to relax. B. Limit social interactions to avoid confusion. C. Engage in regular exercise and a healthy diet. D. Avoid all physical activity to reduce stress. Answer: C. Engage in regular exercise and a healthy diet. Rationale: exercise and a healthy diet C may slow progression. Avoiding activity D or social interactions B may worsen health. Alcohol A exacerbates decline. 112. A nurse is assessing a patient with Alzheimer's disease for depression. Which symptom is most indicative? A. Persistent sadness and withdrawal. B. Increased energy levels. C. Improved cognitive function. D. Excessive physical activity. Answer: A. Persistent sadness and withdrawal. Rationale: persistent sadness and withdrawal A. indicate depression. Increased energy B. improved cognition C. or excessive activity D. are not typical. 113. A patient with moderate Alzheimer's disease is at risk for falls. What is the best intervention? A. Restrain the patient during ambulation. B. Limit mobility to prevent accidents. C. Ensure clear pathways and adequate lighting. D. Keep the bed in the highest position. Answer: C. Ensure clear pathways and adequate lighting. Rationale: clear pathways and lighting C. reduce fall risk. High beds D. increase risk. Restraints A. are unsafe. Limiting mobility B. causes deconditioning. 114. A caregiver asks how to manage repetitive questions in a patient with Alzheimer's disease. What is the best response? A. Restrict the patient's interactions. B. Correct the patient each time. C. Answer calmly with simple responses. D. Ignore the questions to discourage repetition. Answer: C. Answer calmly with simple responses. Rationale: calm, simple responses C. reduce anxiety. Ignoring D or correcting B may distress. Restricting interactions A. reduces engagement. 115. A patient with severe Alzheimer's disease is at risk for pressure ulcers. What is the priority? A. Restrict hygiene to avoid irritation. B. Keep the patient in one position. C. Use a pressure-relieving mattress and turn frequently. D. Limit repositioning to reduce agitation. Answer: C. Use a pressure-relieving mattress and turn frequently. Rationale: a pressure-relieving mattress and frequent turning C. prevent ulcers. Limiting repositioning D or keeping one position B increases risk. Restricting hygiene A. risks infection. 116. A nurse is discussing legal issues with a family of a patient with Alzheimer's disease. What is the priority? A. Appoint a guardian without discussion. B. Discuss advance directives and guardianship. C. Encourage the patient to manage all legal affairs. D. Avoid legal planning to reduce stress. Answer: B. Discuss advance directives and guardianship. Rationale: discussing advance directives and guardianship B. ensures legal planning. Encouraging all decisions C. may be unsafe. Avoiding planning D. neglects needs. Appointing without discussion A. is unethical. 117. A patient with Alzheimer's disease is refusing to bathe. What should the nurse do first? A. Restrain the patient during bathing. B. Force the patient to bathe. C. Avoid bathing to prevent agitation. D. Assess reasons for refusal and offer alternatives. Answer: D. Assess reasons for refusal and offer alternatives. Rationale: assessing reasons and offering alternatives D. respects autonomy. Forcing B. or restraining A. violates rights. Avoiding bathing C. risks hygiene issues. 118. A nurse is caring for a patient with Alzheimer's disease who is hallucinating. What is the best response? A. Ignore the hallucinations completely. B. Administer an antipsychotic immediately. C. Acknowledge the patient's fear and redirect. D. Argue with the patient about reality. Answer: C. Acknowledge the patient's fear and redirect. Rationale: Acknowledging fear and redirecting, C. Reduces distress. Arguing, D. May agitate. Antipsychotics, B. Require assessment. Ignoring, A. Dismisses the patient. 119. A patient with Alzheimer's disease is at risk for dehydration. What should the nurse do? A. Administer 4 fluids without assessment. B. Offer thickened liquids in small amounts. C. Restrict fluids to prevent choking. D. Limit oral intake to solids only. Answer: B. Offer thickened liquids in small amounts. Rationale: thickened liquids in small amounts. B. Prevent dehydration safely. Restricting fluids. C. Worsens dehydration. For fluids, A. Require assessment. Solids only. D. Do not hydrate. 120. A nurse is discussing end-of-life care for a patient with Alzheimer's disease. What is the priority? A. Recommend immediate facility placement. B. Encourage aggressive medical interventions. C. Honor the patient's advance directives. D. Avoid discussing comfort measures. Answer: C. Honor the patient's advance directives. Rationale: honoring advance directives. C. Ensures ethical care. Aggressive interventions. B. May not align with wishes. Avoiding comfort measures. D. Neglects care. Immediate placement. A. Is not the priority.